When you or a loved one is facing a diagnosis like gastric cancer, one of the first questions is always, what else can we do? Beyond the standard medical treatments, there's a huge amount of research out there on complementary approaches to support the body. So today, we're going to dive into what that evidence actually says. Right, so that's the big question we're tackling here. We're going to look at what the actual peer-reviewed science says about specific strategies that have been studied alongside conventional cancer treatments to help support the body through this fight. And before we go even one step further, let me be crystal clear about this. This is a review of published research. It is absolutely not medical advice. The whole point here is to arm you with good information so you can have a better, more productive conversation with your oncology team. They're your partners in this. So here's our game plan. First, we'll quickly define what complementary health even means in this context. Then we're going to spotlight some really fascinating data on two key areas, the turkey tail mushroom and so-called repurposed drugs. After a quick look at some other research, we'll wrap it all up with how to take this information into your next doctor's appointment. So what are we really talking about here? It's simple. Complementary approaches are used with, not instead of, conventional treatments like chemotherapy. Think of it as adding more tools to the toolbox. The goal is to support your body, help manage side effects, and hopefully improve the overall outcome. All right, our first deep dive is into a medicinal mushroom you might have heard of, turkey tail. It's been used in Asian oncology for a long time, but a major study from 2022 looked at real-world patient data, and what they found on survival rates was, well, it was pretty remarkable. Let's just cut right to the chase. The single biggest number from that study is this one. For gastric cancer patients who combine their chemotherapy with a specific extract from turkey tail, it's a protein-bound polysaccharide called PSK. The average post-operative survival time was 6.5 years. And to really put that number into perspective, just look at this chart. The average survival for patients on standard chemotherapy alone was 3.6 years. Adding the turkey tail extract was associated with nearly doubling that time. I mean, look at that difference. That is a huge deal. And just so you know, this wasn't some tiny little trial. This was a massive analysis of Taiwan's entire national health database, looking at almost 6,500 patients. This kind of real-world data is powerful. It calculated out to a 24% relative risk reduction for those who took the extract, which was typically around 3 grams a day. Okay, now let's switch gears from a natural compound to a totally different area of research, what scientists call repurposed drugs. This is this really cool idea where they investigate common everyday medications, things like statins for cholesterol or even antihistamines, to see if they might also have anti-cancer effects. So for example, one study looking at statin use found this really compelling pattern. As you can see, patients who were on statins for less than about 6 months saw a 38% risk reduction. But, and this is the amazing part, for those who use them longer term, that risk reduction jumped all the way to 66%. And it's not just statins. Get this. Another big analysis found that using a specific kind of antihistamine, the H1 drug called desloratadine, was linked to a 29% improved relative overall survival for patients with localized gastric cancer. Who would have thought? The research really doesn't stop there, so let's do a quick lightning round on 3 other promising areas, just to give you a sense of how broad this field really is. First up, lactoferrin. Now, anemia, which is just a low red blood cell count, is super common in gastric cancer, and it's linked to worse outcomes. That's what makes lactoferrin so interesting. It's a protein that helps the body regulate its iron, improving hemoglobin levels and directly tackling a major risk factor. Next up, vitamin D3. Now, this one's fascinating because a major trial actually had kind of mixed results overall. But when researchers dug deeper into the data, they found a really specific detail. The men in the study who supplemented with vitamin D3 saw about a 40% reduction in their risk of relapse. It just shows how these things can affect different people in different ways. And finally, let's talk about inflammation. We know from studies that high systemic inflammation can crank up the risk of gastric cancer progression by over 60%. It's a huge factor, and that direct link is exactly why potent, natural anti-inflammatories, like curcumin, which comes from turmeric, are such a hot area of research right now. Okay, so we've just thrown a ton of data at you, but honestly, the most important part is what you do with it. This is all about feeling empowered to team up with your doctors and be an active part of your own care. So how can you actually use this? Well, Here's a simple 3-step game plan. First, just identify which of these areas seems most interesting or relevant to you. Second, get your questions ready. Be specific. And third, bring those questions to your oncologist so you can partner up and make the best decisions together.
And really, this quote from the source material just nails it. The goal is to enable active engagement with your oncologist, to increase responses and results. It's not about second-guessing their advice. It's about making the conversation richer and more collaborative.
So, we'll leave you with this. After seeing the evidence on everything from turkey tail mushrooms to antihistamines and inflammation, what's the very first question this research makes you want to ask your oncologist?